Medicine is becoming highly advanced in large part by the sophisticated equipment that doctors, nurses use each and every day to heal their patients. If you like to make, design, or even work on equipment or vehicles, then a career in biomedical engineering technician may be the right one for you.
Hi, my name is Jim Clark. I'm the Director of Facilities and Biomedical Engineering at Northeast Regional Medical Center here in Kirksville, Missouri. Clinical engineering is sometimes referred to as biomedical engineering in a hospital setting. It is also sometimes referred to as healthcare technology management. Whichever name is used, the biomedical technicians that work in this department are responsible for maintaining and supporting the medical equipment that is used to diagnose, treat, and aid patients throughout the hospital. In larger research hospitals, the clinical engineering department may also be involved in the development of new types of medical devices. Depending upon the business structure, clinical or biomedical engineers work with a variety of medical devices, from simple items like crutches to complex equipment like respiratory ventilators, imaging systems, or robotic surgery equipment. In the typical hospital such as ours, the biomedical engineering department is, to varying degrees, responsible for supporting and managing all of the medical devices used within the hospital. They do this by testing the equipment, using special test equipment, verifying the calibration and operation of the equipment, or by arranging and monitoring these required tasks to be performed by outside vendors who are specially trained on certain types of equipment. Regardless of who does the work, the biomedical technician is then responsible to document the work using special software applications designed for the purpose. Alternately, biomedical engineers may choose to work in a research facility or for a medical device manufacturer, working to develop and manufacture the equipment that is used for patient care. Most biomedical engineering positions require at least a 2-year associate's degree in biomedical equipment technology, or a similar degree, from an accredited technical college. Similar associate's level training is also available in some branches of the military. Either of these degree paths will usually include a multi-week internship in a clinical setting. Some positions may also require that the candidate be a certified biomedical equipment technician. This certification is administered by the Association for the Advancement of Medical Equipment, also known as AAME. And candidates must have a certain level of education and a certain number of years of experience in order to apply and test for this certification. Technicians wishing to advance their careers can pursue 4-year degrees also, or can attend specialized training provided by the various device manufacturers. A typical day in a hospital such as ours involves performing preventive maintenance on medical equipment, such as changing filters, lubricating mechanical systems, running software diagnostics, testing and verifying calibration of equipment outputs on equipment such as defibrillators and centrifuges and patient monitors. The typical day also includes making repairs to medical devices as well, and these repairs are often of an emergent nature, requiring the biomed tech to respond immediately, regardless of the time of day. While many tasks that a biomedical technician in a hospital performs on a daily basis require only a single technician, there are other jobs which might require more than one person to perform. Tasks like troubleshooting networked equipment, such as in a nurse call system, or installing multiple device system upgrades, such as installing a whole new fleet of infusion pumps in a hospital. People who like to repair electronic and mechanical devices, such as computers and automobiles, who enjoy troubleshooting technical issues with such equipment, and who enjoy science and engineering might be interested in becoming a biomedical equipment technician. When hiring for this career, I look for someone who demonstrates an interest in working on various kinds of equipment and who demonstrate an understanding for the importance of documentation and paying attention to details. And just as importantly, the candidate needs to be able to communicate effectively and courteously with other people, since interacting with and working alongside the clinical staff who use these medical devices is a necessity. I'm one who does enjoy working on equipment. I enjoy troubleshooting and resolving an issue with equipment, and particularly medical equipment. And the smile that I get sometimes from a nurse or a doctor when I've successfully fixed their piece of equipment brings great pride to me. because it means that they can go ahead and do the job that they love, which is taking care of the patient. And in the end, that was the reason I got into this field, to be able to help in some way with people who are sick, people who are in need. So if you enjoy working on equipment, and if you feel a need to help people who are in need, who are sick, then perhaps a job in clinical engineering is for you too.
And joining us live from Northeast Regional Medical Center is Amanda Selby. Amanda, welcome to today's program. We hear your colleague in crime, Jim, got called off for an emergency.
Yeah, so you guys are stuck with me, but I'm happy to answer any questions and tell a little bit of Jim's story as well, how he got into the field.
Yeah, absolutely. I think we have some questions coming in right now. We may be able to go right to those questions.
Absolutely.
All right, I think we have Clinton Technical School Health Science Program HOSA chapter. Welcome, Clinton. Do you have a question for Amanda?
I actually have two, if that's all right.
Yeah, go ahead.
All right. One of them is, what is the difference between a clinical engineer and a biomedical equipment and technician? Sorry.
Good question. Good question. Amanda?
Yeah, so the biomedical technician is the person that's working on equipment, while clinical engineers are more often the ones that might be helping to either build new equipment, research new technology, maybe in charge of integrating equipment. So, but the terms can also be used interchangeably.
And then my second question would, if a piece of equipment fails, what would be the process of fixing it?
Well, obviously, you always have a backup. You always have a fail-safe so that you can keep patient safety as your number one consideration. But if it's a failure that our technicians are able to repair, then they'll take it, they'll repair the equipment, test it, and then redeploy it. If it's something that's beyond the capabilities of a technician, then we would have a vendor or a technician from the company that builds that equipment that would come and repair it. Sometimes if it's going to be a long repair, we'll get a loaner piece of equipment that we can use in place so that there's no disruption to patient care.
That's all I have.
Great. Well, thank you for joining us, Clinton Technical School. All right, Amanda, we have a couple more questions that came in. So, and to follow up on how to fix it, what happens if the machine does break during surgery?
Always have a backup.
Always have a backup. Great answer. I guess what is the favorite piece of equipment that you get to work with?
Well, I would say that probably for Jim, I know he enjoys working a lot on the high-end technical equipment just because it's fun, it's new. So things that he's worked on recently would be, we just got a brand new MRI unit. So he's been working with the physicists and construction workers to build the vault, get the unit up and testing completed. So I think he's been having a good time with that.
Okay, good deal. I think we have another school that's ready to go live with a question. I think Van Horn High School, is that you? Project Lead the Way? All right, you have the floor. Go ahead and ask your question, Van Horn.
How do you think technology will change the way we care for patients in the next 10 to 20 years?
Amanda, did you hear that? I didn't catch it. Can you speak a little bit louder into the microphone, please?
How do you think technology will change the way we care for patients in the next 10 to 20 years?
How do we think technology will change the way we care for patients in the next 10 to 20 years? Is that the question? Okay.
Yes.
Yeah. You know, who knows? I think every day new technology is engineered, it's discovered. I think the goal is always to keep the patient as safe as possible. We like We've seen technology like surgical robotics that can make patients have quicker recovery time. They have less pain during recovery. There's lower risk for infection. So things like that, technology improvements that keep the patient safer and make them more comfortable, and also make the procedures more have positive outcomes is ideal. So better alignment for doing joint replacement or lower risk for infection. So I think that's the direction we're always trying to go.
Okay. Yep. Technology is constantly improving every day, right? And every year we get a new smartphone that comes out. So you got to think that new diagnostic equipment, new machines to help treat and care for patients is constantly going out there. Amanda, a couple quick questions. At Northeast, do you do any type of job shadowing or internships for students?
Yeah, we don't have internships, but if somebody's interested in job shadowing, they can always reach out to us, and we'll do the best that we can to accommodate.
Okay. And then another quick question, do you offer any type of tuition reimbursement program? So if I start there in an entry-level job or another position, I could possibly get some college assistance?
So, the minimum education that we mentioned is an associate's degree, a 2-year degree. So you could come in as a biomedical technician with a 2-year degree. And then if you were to decide to go on and obtain a 4-year degree or additional certification that's related to the job of a biomedical technician or clinical engineer, then we do offer tuition reimbursement. So that can help cover the cost of classes, books, things like that. So that's always an option. And there's so many scholarships available too. So always do your research and look for scholarships. That's another great way to help pay for education.
Okay, excellent. Amanda, before we head out, any last inspiring words for the students today?
Yeah, you guys are one step ahead of the game by being here today. So the best thing to do is to expose yourself to different career paths. See what you like, see what you don't like, make those connections and relationships, and best of luck to you.
Thanks, Amanda. And thanks to Jim also for doing the video for us and everything. We're sorry he couldn't make it, but we understand that fixing those machines and keeping people healthy is priority number one for you at Northeast.